ranked all-time NFL Chet. He can tell you quite a lot about his experience with the NFL, and he's been in this industry for a while and is very, very well versed on cannabinoids and how they affect the human body. And the closest to me is Mr. Josh Kinney, who is the 2006 Major League Baseball World Series winner. I do not envy this man one bit with all the pain that he's gone through with his surgeries, and he can talk to you all about that. So what we'd like to do today is open the discussion on how you address opioid addiction with cannabis. And I think I'd like to start with Dr. Tonkin. I want to move the microphone closer to you. So we were talking earlier, and apparently you have extensive sports experience yourself.
Well, I was a Division I track scholarship at Virginia Tech, but I wouldn't say I was nearly on the level. Actually, Josh and I grew up very close to each other in Pennsylvania, and I always tell him that I never got the recognition that I deserved. I was all-star Little League first base player. So any respect for that. But yeah, so I actually am a board-certified anesthesiologist. I actually went back and did another fellowship in interventional pain at Henry Ford Hospital, Detroit. And now we have elite pain managements across the country. We actually treat opioid addiction. We also treat with opioids for pain. I'm an interventionalist, so I'm the guy that can do the injections or operate on your back. I'm a minimally invasive surgeon. And when I got out of fellowship, I thought I could fix everybody by injecting them or operating on them. And I found out in 2 or 3 years that actually I wasn't able to do that. So I opened up a clinic. The first one was in Springfield, Missouri, where my wife practices. She's a physician also. And Josh and I rekindled our little friendship from back in Pennsylvania. And so we got to know each other pretty well. But we do treat pain using opioids, but we also do it in a multidisciplinary fashion. So we go to physical therapy. If you need to have surgery, you need to see a psychologist. I was approached not too long ago by a company to see if CBD would actually help decrease the pain scores and be able to take us off some of the narcotics these patients are prescribed. And I took it on myself to actually give it to people that were addicted or have opioid use disorder and see if it would help them with their with the Suboxone treatment and things like that. And we found a great reduction in the amount of opioids we've been able to prescribe patients. And also, there's quite a few people in our little study we had going on who were actually be able to stop using Suboxone at all just by using CBD oils. So it's pretty fascinating for me. And I think we're just opening up the can of what's going to happen in the future. We're trying to have all we can treat with it.
That's fantastic. Marvin, do you want to give a little bit of background?
Yeah, I played in the NFL for 12 years. Blessed enough to win a Super Bowl and be retired and went into the financial services industry as an investment advisor. Got into the cannabis industry about 3 years ago. Educated myself. I don't smoke. I do like CBD, but I don't smoke the THC side. But I do understand the benefits of that side too. But the thing to me is pain management. And if there's ever a sport that needs to experiment with cannabis, as far as treating pain management, it's the NFL. I retired in 2000. And I know the pharmaceutical routine that the players went through back then and they're going through now. And my thing is to get to the NFL to look at some alternatives instead of those opiates and pharmaceuticals that the guys are taking, because there is a routine, a regimen that guys do. Starting now, they're in training camp. You know, football is a collision sport. You know, baseball and basketball, those are contact sports, but football is a collision sport, so they do need something for pain management. And my takeaway line is I've been around NFL players for the last 20-something years, 25, 26 years. My son plays up in Canada, and I know plenty of guys that left the game addicted to pharmaceuticals, but I don't know anybody that left the game addicted to marijuana. And Roger Goodell's, you know, their takeaway line is they're following the science. As the NFL, the biggest sports league in the world, the biggest sport in America, they need to lead the science. And I think it will go a long way in getting rid of this negative connotation about the cannabis plant because this thing needs to be researched and studied, and we need to get all the benefits out of it that we can. And I'm working diligently.
You got it.
Thank you, 30 times the charm. To get this into the NFL and get it researched. And whenever there's a dangerous industry, be it trucking or coal mining, it's not the company that takes the initiative to get this done, it's the union. And so I'm working with the NFLPA to try to get CBD and cannabis study as for pain management. Also, the NFL has an industrial disease called chronic traumatic encephalopathy. I can say that, but not deal with you. But that's the NFL's industrial disease, and the government has a patent on CBD as an antioxidant and neuroprotectant, so I'm definitely going to try to get that done too. And I just want to keep this movement going because to me, it's a movement. It's not an industry yet like the tobacco or alcohol industry. It's just a movement, and we're all running now. And so I want to, just keep running and moving this moving forward. Thank you.
All right. That's tough to follow up right now. My name is Josh Kinney. I'm a former Major League Baseball player. I played professionally for 15 years, 4 years of college. And I'm rather new to the industry. I just got on board with Dr. Tonkin. We're good friends. We grew up in the same part of northern Pennsylvania together. So my perspective on this is from a professional athlete's view. And my sport, we play 162 regular season games, and we get 1 or 2 days off a month. And that's not counting spring training. So baseball players, we hammer our body to the max every single day. And I personally know what it's like to do that, to get the most out of your body every single day, and the pain that you go through. And managing your pain as a professional athlete is a major deal in sports. I took many pills to keep me on the field, all legal. But the damage that it can cause to the inside, you don't care about. You care about being on the field. So from my perspective, when I started learning about CBD and some of the great health benefits that it offers, and understanding and gaining knowledge from Dr. Tonkin in regards to how you can manage pain with it, I was very excited to come up and come to a class and learn more and more about it, and hopefully try to integrate some kind of CBD products into the sport of baseball. Whether that product is pill form, creams forms, whatever, I think there's a very, very big window of opportunity in sports of all ages to offer a safe alternative to managing your pain. And that's where I'm at, and that's my perspective. And I look forward to seeing where this goes and being able to provide athletes of all ages and all sports something of CBD-infused products that can help them out. Thank you.
So I'd like to pass it back to Dr. Tonkin. Really quick here, you look like you have...
Actually, I was just going to say, when Marvin said when he retired from playing professional football, he went into financial services, and I was whispering in his ear, I bet you it was collections.
So, Dr. Tonkin, we were discussing earlier, and I'd like for everybody to understand, what do you see on a daily basis as far as addiction is concerned?
I was actually just on a roundtable with Senator McCaskill from Missouri 2 weeks ago on a Friday, and we were talking about all the different problems, and we do it in the clinic in Missouri. And one of the problems in Missouri is it's the only state in the country that we don't have a pharmacy monitoring systems where we can get on the computer and look where the patients are getting their medications. So when we were discussing this, I wanted to actually address with her one of the bigger problems is, a lot of these people are using these opioids. They assume that these medications are coming from Detroit, Michigan, from Mexico, from out of the United States. And it's really the thing I think we need to really stress is it's the physicians that are prescribing these medications. The patients that have been buying them off the street aren't getting them, shipping in from places. So my big thing with the senator was we need to start educating the physicians to stop prescribing so many medications. And if we have something as an alternative to take away the pain that you can't get addicted to, you can't overdose, let's do that. There's too many deaths happening in the United States right now. Another thing is that, you have to realize that we kind of separate people that have addiction problems, which is classified as opioid use disorder. We look at them as the homeless patients, and we do have homeless patients, but most of the patients have a legit, 2/3 of them have a legitimate prescription for these opioids. So we have to, it can happen to any one of us in the room. If we put a raised hand, if anybody would actually admit to it. These medications, we treat physicians at our clinics, we treat prosecuting attorneys. We have to understand this opioid epidemic is killing all our young and old alike, and we need to do something about it. But one of the things we have to look at is what are their alternatives to take care of their pain. But number two is we have to really take a hard look at the physicians that are prescribing all these medications.
That's a fantastic answer. Thank you so much.
But the physicians don't want to hear that. Because we're kind of egocentric and think that we can't do wrong, but we're the reason that these pills are getting out on the street. So 1 out of 3 people that actually come to a pain clinic are, for better words, lying about their condition, and they get medications. Another problem is probably not the forum here to talk about is the way physicians are reimbursed these days. They have 10 minutes to be with you in the room, and they have diabetes, high blood pressure, and everything else. And all the patient wants to talk about is their pain. So the doctor very, very quickly writes for their Percocet, give them the prescription, let's start going over to your diabetes and things. So it's a huge problem that the doctors are just perpetuating what's going on with all these opioids. But it's a huge problem. Anything, as the press knows, anything you look at the news, it's all about opioid use disorder, and we've got to attack it. But we can attack it, of course, using buprenorphine-containing products like Suboxone or Bunadil or something like that. But here we have something that we can use to treat these cravings that these patients have. And there's scientific literature behind there that this actually works. And in my clinics, I can tell you personally that this CBD does work for the cravings. So why not have these patients on something that you can't overdose? The other problem is whenever you're taking these medications like narcotics, a lot of these patients are taking benzodiazepines, so Xanax, Valium, Ativan, things like that. And all the psychological associations, American Psychological Society, all say that you should be taking these medications chronically. When you mix opioids and benzodiazepines, your respirations decrease and people overdose all the time on them. So here we have a product you can't get addicted to, you can't overdose, like I said, and it takes care of cravings, anxiety, and things like that. So why don't we move forward and start addressing with medications other than things that are so deadly?
Absolutely. Yeah, we agree with that. Thank you. Let's talk about pain protocol in the NFL, Marvin. Would you care to explain to us who, we see you athletes as warriors.
You have to play through the pain. That's what they tell you. But the thing is that, like I say, guys start this routine, and either you're taking anti-inflammatories, you're taking pain blockers, because like I said, it's a collision sport, and it goes on from July to January, and then you're supposed to stop. By the time I left the league, my last few years, I could write my own script because I knew what I needed. And during the week, just to get through practice, I took Indocin or Naproxen, which were the anti-inflammatories. Before the game, I took Toradol. Not that many teams still take that, but this was back during the 90s, which is I consider the dark ages, since it's a pain blocker from all the pain that you had during the week, and you go out there and play the game, and after the game, it's Tylenol 3, it's Percocet, it's whatever it is, and then that routine goes on for 16, 17 weeks. Because you have to be there, and Josh can kind of tell you about, you have to be there to be available, because the best ability that a player has, be it baseball, basketball, or even football, is availability. So you have to be available, and there's a lot of pressure on you from the GMs and the coaches to be available to practice and to play. And the external and internal pressure that you put on yourself, because there's a lot riding on your livelihood. So you have to be there, especially as you get older. And the thing that I wanted to get is CBD into the NFL, because I can envision a time in the NFL in the future, instead of taking your Naperson and the Innocent, why can't the guy vape, take his film work home on a Wednesday night, go home and vape, wake up and go to practice, and there's no ill side effects on your kidneys or your liver. And I can see that happening, and that's the thing that I want to get, and I say in the very near future, because the NFL has something called TUEs, temporary use exemptions, and they let the guys that have, ADD and the ADHD take their Ritalin and their Adderall. So why not do that with CBD? And I think, that would be the surest way to get into the NFL. But the other thing is THC, I know that works well with pain pills, but instead of giving the large doses that you're getting, cut that down and give them some THC. And it's all under doctors' care like they're doing it now. We're not talking about giving a guy a dime bag and going back home. We're talking about, give them, I don't know, 10 milligrams, 20 milligrams, what have you. And like I said, I have ex-teammates and peers. I had an ex-teammate that called me in January. He was taking 8 Percocets a day, and he's been out the league for 12 years, just dealing with the pain. And I know a lot of guys that are like that, and these guys I'm trying to help with giving them CBD and giving them oil and things like that. So, this opiate pharmaceutical problem, it's running throughout society, and sports is a microcosm of society. So if there's 10%, 20% of society that has an issue, it's in sports. And like the doctor said, we've lost a lot of people, some iconic people, because I came of age during the 80s, the Breakfast Club, the Cosby Show, and things like that. But the three biggest singers were Prince, Madonna, and Michael Jackson. And we've lost 2 of them to opiate addiction. And we've lost a couple football players to that also, and guys are suffering, and we just want to give them an alternative.
Josh, with your injuries, I hate to go into more details, but can you describe, how many surgeries have you had?
Excuse me. I've had 4 major surgeries. I've had 3 on my elbow and 1 on my shoulder. I've had rotator cuff, major rotator cuff surgery, labrum tear. I've torn my UCL in my elbow, which is called Tommy John surgery. I've broken my funny bone. That was not funny, I promise you. I made a throw, and the best way I could describe it is when I threw the ball, as I released the ball, it sounded like someone took a carrot and just snapped it.
Ouch.
And that's what it felt like in my elbow. I broke the bone where my ligament was attached and actually just pulled the bone apart, and I had to have an 1 1/4 screw put in there with a washer on it. So that's still in there. And then I've had a nerve, I've had to move my nerve out of my elbow groove so it wasn't sliding back and forth on the bone that it broke, and the screw and so on. So that sounds all gruesome a little bit, but it's kind of just part of the job. What doesn't kill you makes you stronger, and as Marvin said, you have to play through the pain. So I'm proud to say that each one of those injuries that I had, I got over it, and I was a better player for it. However, dealing with those types of injuries comes, dealing with your pain. I got to, after my first major elbow surgery, which was in 2007, I never had a year after that I didn't have to take anti-inflammatories just to keep the inflammation in my elbow down. So it got to a point where, I was looking in the mirror and I was saying, this is what I have to do, but where am I going to be in 10 years from now? What is this stuff that I'm taking to keep me on the field and keep me at my max performance going to do to me down the road? I'd like to think I was a strong enough-willed individual to not be addicted to stuff, but I was. I had to take it. It was my routine. I believe it worked, and it kept me on the field. So that's what I did, and that's what many players do. It's part of your job. So why I'm up here, just like he touched on, is there a safer alternative to manage your pain, to keep players on the field, and better for your body? I mean, why do we have to blow our kidneys apart? Why do we have to damage our liver? What are the long-term? I feel like football there's been more focus on players, like you were mentioning, after their careers because of the head injuries, because of the banging of the body. You know, you don't hear that much about former baseball players with liver failure and kidney failure, and so on. I'm sure it's out there. I don't know all the facts of it, but I know we go through the anti-inflammatories. We go through the opioid. I mean, it's part of the game. So, you know, I'm very excited to see where this goes. I'm very excited to be a part of it here at ground level and move forward and see what can actually come of giving athletes something, a better outlet, a safer outlet, and have it be good for your body, and it works. And that's where we're at, and that's why we're up here right now.
Yeah.
Funniest thing is you have three guys up here that are all kind of laid back, but we just wanted to joke around a little bit. So, you know, he has his surgeries and stuff. I just want to say I was the ball boy at our high school football team, and I had my appendix out, my wisdom teeth, and things like that.
I think I get Josh beat. I had 7 major surgeries. I had both my shoulders redone. I got zippers there. I had a broken sternum, broken quad, a torn quad tendon, peroneal tendon in my foot, ruptured disc in my back, and then I got my fingers correctly done. They had to go on and do my fingers. And the thing is like, I was able to come back from, but I was under pharmaceutical regimen. And you don't think like you can be addicted to anti-inflammatory, something like Indocin or Naproxen. But, you know, they make you feel good and you can go out there and perform. And you're taking 1 a day, then you're taking 2 a day, and then you're taking 2 and 2. Because to me, we call it oil for the Tin Man, because you're sore, you're stiff and whatever, and they would work. But, you know, you got to pay the piper, and I don't know what's in the future, knock on wood. Hopefully, you know, I try to work out and what have you. But a lot of my teammates and peers, they were damaged by it, and they're still damaged by it. And we just, like we said, we just want to give them a safer alternative. And the thing is just, you know, get rid of the negative connotation about the cannabis plant. Follow the science, see the medicinal benefits of it. And I just think that if the NFL gets behind it, it will go a long way in society. Because CBD will do the same thing for a 28-year-old professional football player as it will do a 12-year-old Pop Warner kid. It acts as an antioxidant, neuroprotectant, and anti-inflammatory. And so this is where I want to see it, and I'm excited about this industry. Well, not industry, I'm excited about this movement. And I just want to be a part of it because eventually the wall's going to come down.
Dr. Compton, you know, you also talk to people about medical marijuana as well as cannabinoids, which are part of the plant. When we take cannabinoids out of the hemp plant, which is not psychoactive, so for the general public that isn't aware, there is part of the plant that will not make you high or stoned. Could you talk about that cannabinoid CBD, which is what we're on here to discuss, and what types of conditions have you seen positively addressed?
Sure, everybody's, you know, is a physician. There's not too many doctors out there that actually write for medical marijuana, and I think it has a horrible connotation. When I actually met the nice people from Isodiol, I spoke to them very frankly and about the industry in general, and to actually have physicians that want to partake in writing for medical marijuana or use CBD, I thought they needed to present their products in a more professional manner. So we spent a lot of time talking about how that could happen. And I think we're coming up with some good stuff, and we're actually doing some research. So the nice people at Isodiol actually understood that we can't, and the medical profession does not really embrace some of the negative connotations when people are just going out and getting high. I don't think you'll really win any doctor over by presenting all the research you have about CBD and medical marijuana by doing such. So I think the forum that we're trying to do is educate the physicians so we can use these medications and do it in a very professional way. So I tell you, in pain, it's a horrible thing because every patient has pain. You know, it's chronic, and the definition of getting chronic pain is 3 to 6 months of pain. So all these patients that come to these pain clinics and stuff, they have anxiety and depression wrapped up in it. What we usually do is we've noticed, and we've done the questionnaires and a little bit of research, is it's helped out with the anxiety. Also, what we've noticed is their sleep is much better, so the insomnia these patients have is gone away in their quality of life. Our whole goal at Elite Pain is actually, and I'm sure it is with everybody in the industry in here, in isodiol particularly, is get these people's lives back. All these patients, you know, they lose their job, they end up sooner or later, and I tell these patients either we have to do something about this or you will end up divorced. You're not being a good dad, you're not being a good husband, wife, because of these opioids. And what our goal is get these people off these dangerous medications that are killing them and getting on something that you can't get addicted, you can't overdose, and they can get their life back so they can become a better dad, get back to having a good relationship with their husband or wife. And that's what the whole thing with Elite Pain and isodiol is. We're trying to get people's lives back. Instead of using dangerous medications that can kill you, let's fix it. And society in general is going to be a lot better. But in Elite Pain, we actually have noticed a huge decrease in the pain, the addiction, the cravings, and things. I'm not sure if you're really aware with the Suboxone or the buprenorphine-containing products, but before you can actually start those medications, which are good medications to get their life back, but we do not want them to exchange one addiction for another addiction. So what we usually do is we have the patient start on a buprenorphine-containing product like Suboxone or Unavil, but to get started on that medication, you have to be in moderate withdrawal, and everybody that has opioid use disorder, they do not want to go into withdrawal, and that's why people keep on using and using and using. So what we've been doing is using this product to actually bridge the gap to get to the moderate withdrawal so we can start the medication. Another thing we're doing is just continuing the CBD along with the medication and watching how quickly they can get off the Suboxone therapy at all. And that's our whole life. We do not want to just put them on Suboxone for the rest of their life. Let's fix the problem, get over it. We all have problems in here. Every one of us is just a different problem. Let's attack the problem, get over the problem, treat the problem, and then get off these medications. So we've been using it for a lot of things in the pain realm, and I think we just need to educate the physicians that this CBD supplement is a wonderful supplement, and you should feel good about it. I've testified in a couple of federal grand jury cases on pill mills, and doctors are very, very scared to write opioids at all now. So you usually have someone who will just write it for anybody as much as you want, or you have doctors that we get all of our referrals for. I'm not writing it anymore because I don't want to be scrutinized and I don't want to go to jail for writing these dangerous medications. Also, at some point, in some states like the state of West Virginia, if you become addicted to these medications, you can actually sue your physician. And just think of how many doctors would be sued if the public knew this. The other thing is it's almost medical malpractice. I'm not an attorney, but it's almost medical malpractice to be giving patients all these hundreds of milligrams of morphine equivalents or combined with these dangerous medications like benzodiazepines and things like that. So I think when these doctors get more educated that there is an alternative that they can suggest to these patients and not put them on opioids and send them to the root of the problem. Send them to get the injections, send them to the surgeon, send them physical therapy and things like that. And you should always do these things before you ever write an opioid anyways. You shouldn't go from back pain to writing an opioid. The thing I always worry about, Josh and Mr. Washington here is, they're talking a lot about these NSAIDs and anti-inflammatories, and they're horrible for your kidneys. These Toradol products should be taken more than 3 days in a row, and from what it sounds like, they've been taken every day for years. And what's going to happen in the future, I think we're going to run into a lot of renal failure or some big-time problems with these athletes. It's just not the concussion syndrome and things like that. I think we're going to see a lot of other health problems come from this. So I'm a little bit worried for them in the future because I actually know Josh, and he's probably going to have to come and get some help or something like that. But hopefully,
what about me?
You just take help. I mean, no one, whatever he asks for, someone's going to give it to him anyways. Yeah. But so I think there's the NFL's in huge scrutiny now, and all these players are coming back, and there's a lot of health problems with them. So I think it's just going to be worse. And every year these players get bigger and faster. Can you imagine what the players right now are going to be, 15 years down the road? And what's the average playing time of an NFL player?
Average career is 3.5 years.
Yeah, I think I read 3.5 years.
Wow.
That's pretty bad. The thing that we're trying to do, I'm lucky enough to blessed to have a great father. He runs a lot of the Pennsylvania State Athletics, and we were talking yesterday, and actually being able to get some of these products like CBD, no addiction, but neuroprotective, and get them into the high school realm too. I can guarantee you that every family member, every parent